Hi, everybody. My name is Julie Balasal. I, along with Kieran, are going to be presenting to you today about our CurePSP Advocacy Steering Committee, all the updates that we've had over the past year in 2025, and talk a little bit about how you all can get involved in 2026. And actually 2025. But first, so my name is Julie. I've been volunteering with CurePSP for a few years. My mother was diagnosed with cortical basal degeneration in March of 2022 and passed away in January of 2023. And I have been working with Jessica and the CurePSP team to help sort of build our advocacy program. And in my day job, I'm a trained social worker, and I am the manager of community organizing at IMALS. So I'm joined today with Karen. So Karen, I'd love for you to share a little bit about yourself too.
Sure, thank you, Julie. My name is Karen Huff. I am the co-chair of the legislative subcommittee, along with Julie. And my connection to Cure PSP and our disease community is that my father was a Vietnam War veteran, and after a 5-year battle with PSP, he passed away in September of 2024 from complications due to PSP. And after his passing, I've been very motivated to use my skills as a lawyer. I have experience working in both the federal government and in congressional affairs at a nonprofit organization in DC. And I really want to utilize my skills to advocate and push forward the policy agenda for Cure PSP. And have been very honored to have had the opportunity to work closely with Julie and Jessica and others to really push forward our agenda.
Awesome. So Karen and I are today are going to run through a PowerPoint, and really excited to get give you a sense of what the steering committee for the advocacy steering committee for Cure PSP has been up to. Talk a little bit about what that is, and give you a little bit more of a sense of how you can get involved, and the pieces of advocacy that we're still really trying to focus on as we move into 2026. So we just wanted to first welcome everybody. Some of you may have come to some of these before, and some of you, maybe this is your first time. But thank you for wanting to learn more about advocacy, and legislative advocacy in particular, and specifically how it pertains to our disease community. So just thanks for taking the time to register and come to this session. And thank you for all of the actions that you've already taken, if you have, emails, meetings, anything that you've done with your congressional representatives to raise awareness about our agenda items makes the biggest difference in the world. So just wanted to also thank everybody for the pieces that you've already done, if you have, and welcome any new faces as well. So I'll get us rolling here, and talk a little bit about the advocacy goals that we have as an organization. So we focus on some specific areas in different ways using different legislative or advocacy avenues. And so these are not in any particular order, but just sort of a broad stroke of what the priority areas that we have. And a lot of this was based on what we heard from the community. So Jessica and I put together a survey last year about what are the advocacy needs that the community would like Cure PSP to work on. And so these sort of came out of that session of that survey of trying to find out what are the most important issues. And so research funding on the federal level was one of the biggest and sort of loudest that we heard from the community in terms of priorities and pieces that they really wanted us to focus on, and sort of spanning whether that's National Institutes of Health, or National Institutes of Aging, sort of any federal levers or pools of money to have more specific focus on our disease community. So that is something that we've continued to work on. Durable medical equipment or DMEs, the high cost of those, and how essential they are for quality of life and for caregivers. And so what can we do to expedite coverage and eligibility for our disease communities? Veterans Affairs. So really working on how the VA views our disease groups and the benefits associated with them, and coverage of needed services across the board, sort of whether that's in public or private insurance, disability benefits, making sure that it's as streamlined as possible, and what can we do to expedite Social Security specifically for rapidly progressive neurodegenerative diseases, and for sure the importance of how we support caregivers sort of generally as a society, but also our community of caregivers. What can we do to continue from a policy lens to make sure that they're included? So those are some of the sort of broad strokes that we really heard loud and clear from everyone about the issues that we wanted to work on, that you wanted CurePSP to work on. So one of the other huge things that we've heard is what's going to happen in terms of all of those really important issues. What is the connection between that and the National Plan to End Parkinson's Act? So where do those two things fit together, or sort of two areas fit together? So just as a refresher, in 2024, the National Plan to End Parkinson's Act was signed into law, which was a huge win for our community because it was the first time some of our diseases were ever mentioned in significant statute. So that was a huge win. And basically, what this piece of legislation does is that it establishes an advisory committee for stakeholders, whether they're federal or non-federal, subject matter experts in different Parkinsonian related diseases, to really sort of create a path forward for curing these diseases. And so what can we do to sort of create a national strategy to address sort of these overarching issues, and really continue to make progress? And that includes the atypical Parkinsonian diseases, including MSA, PSP, and CBD. And so, so the law was passed, that's great. And now it comes to implementing. And that's where we're at right now. So the council will focus on creating this panel of experts to go through and look at the different avenues that we can increase efficiencies across federal departments, academic institutions, clinics of care, and create a report to give back to Congress, and make suggestions, and some of that will include funding suggestions around how to create this national plan. There are two seats on the council that are specified for patient advocacy groups. And part of what CurePSP is committed is, regardless of who's sitting on those seats, sitting in those seats, to continue to follow really closely and monitor this group. It hasn't officially been seated yet, so that's part of the implementation process that's taken a little bit longer. But we are hopeful, regardless of who is a member of the council, that we will have avenues to advocate for our community. So with that, I will talk a little bit, sorry, send it over to Kieran to talk a little bit about how the subcommittee, or how the steering committee as a whole also is going to be working on some of these issues that the community has identified. So Kieran, take it away.
Sure. Thank you, Julie. So when we started out in the first couple months of, putting our heads together and trying to figure out what we wanted the steering committee to achieve, we found that it was really important to define our mission. And this was especially true in the midst of political winds that have been rapidly changing in Congress and DC as a whole. So collaboratively, we sat down and we crafted the mission statement that you see here on the slide, to kind of serve as our true north and to guide the work and decisions of the steering committee. And you can read the entire statement at length, but I especially want to highlight the goals there at the bottom, which have been guiding the work of our steering committee. The first one being to raise awareness of the diseases in Congress and amongst the broader public. Number two, to educate on the impact of federal policy. And number three, to build a bridge to bring together people with lived experience with PSP, CBD, and MSA, medical teams, researchers, policymakers, government agencies, and donors to shape and advance relevant legislation and public policy measures. So these have been the kind of guiding principles that we've carried forward in our work. Julie, if you wouldn't mind going to the next slide. Thank you. And especially with appropriations. So this was kind of our first dive into the appropriations process of fiscal year 2026. And for anyone who's kind of watched the news coverage of the government shutdown, you may have heard the word appropriations thrown around a lot. And what appropriations basically refers to is the process by which the U.S. House and the Senate determine the specifics on how money will be spent and appropriated to different government departments and programs. So in doing so, the Senate and House typically produce both a bill that outlines the appropriation measures that should be taken and an accompanying report. So this report language provides more detailed guidance on specific actions that departments and agencies should take. So with that background in mind, CurePSP celebrated a huge win this year with the incorporation of language submitted by CurePSP in the Senate fiscal year 2026 Labor, Health and Human Services and Education Appropriations Report. It's certainly a mouthful, but to make this happen, CurePSP spent about 2 months drafting the report language and having meetings with various offices in both the House and the Senate in hopes that they would submit that language to the Appropriations Committee and have it included in the report. And so, Julie, if you wouldn't mind going to the next slide. You can see here, this is CurePSP's report language. And bolded especially is the important part of this, which basically directs the National Institute of Neurological Disorders and Stroke, so NINDS, to do the following. Number one, it instructs them to ensure that PSP, CBD, and MSA are included in relevant programmatic initiatives, data collection efforts, and strategic planning activities focused on neurodegenerative disorders. And number two, give specific attention to the development of diagnostic biomarkers and therapeutic targets. So while this language was not included in the House report, it was still a huge step in making sure that focus is kept on our disease groups, and it lays a strong foundation for success in having our language incorporated in the next fiscal year in both the House and Senate reports. Julie, I'll hand it back over to you. Oh, sorry, I think you're muted.
Sorry, it's only been 5 years. Yes, that's a huge win, and thank you, Karen. A great foundation for us to work on. And so part of the work that we're also doing is at the subcommittee level for people who are interested in getting involved in advocacy in their own states, is to develop a guide for how to thanks in large part to one of our incredible steering members, who I hope is on this call, Lee Lange, to create a guide that would help people understand the process for how to file for a state resolution for Month of Awareness in May for PSP, CBD, and MSA. And so this is one example of what this subcommittee is working on. It's a very tangible thing that this committee has really focused on and created a lot of opportunities for people to get involved in their own communities. I really like to focus on the fact that we can't always control all of the things that are happening in our political sphere, but there are avenues that we can focus on. And so this is a really great way to ensure that advocacy and awareness in your state is happening. So this is something that we are going to be making available to everybody in 2026, in time for preparation for the May month of awareness. And it will sort of help people break down the process and give you tips um, on sort of who to talk to, what language you should use, how to reach out to people. Each state is different in terms of their own legislative assembly. So it's not going to look the same in every state. But the team has been really thoughtful in thinking about how we could use this tool, regardless of what's happening in the outer political sphere, to use that as a way to raise awareness. And then we'll build on that with more resources from this subcommittee about how to do congressional meetings, how to really kind of utilize the avenues that we have ahead of us as constituents on the state and federal level. So this is a really exciting group, and they're really motivated to use the knowledge that they have and create some more really wonderful resources. So that is that committee, and I will turn it back over to Karen for the Legislative Agenda Subcommittee.
All right. So last but not least is, like Julie mentioned, the Legislative Agenda Subcommittee. The key goals of our subcommittee have kind of been built around steadily building our presence on Capitol Hill and strengthening the voice of our community at the federal level. And so to that end, there were several events this summer and fall that CurePSP took part in. Julie, if you wouldn't mind hitting the next slide. Thank you. Um, the first event was the Parkinson's Policy Forum, and it took place in September of this year. It's a nonpartisan event that's hosted by the Michael J. Fox ADPA and several other organizations. And CurePSP joined over 250 patients, family members, care partners, researchers, and clinicians from 45 states on Capitol Hill to meet with members of Congress and their staff. So it was quite a turnout, and we all gathered to share our personal stories and make a call for action, basically around two main goals. Number one was increasing federal research funding, and number two, implementing the National Parkinson's Project, including seating the Federal Advisory Council as soon as possible. So those were the two main asks that our group kind of had for the members of Congress and their staff that we met with. Of particular note during the policy forum was number one, Congresswoman Jennifer Wexton was honored, and she's pictured there to the right of this slide. Congresswoman Jennifer Wexton was honored with a Lifetime Achievement Award for her instrumental role in pushing forward the National Parkinson's Project and making it a reality. So as many of you know, Congresswoman Wexton previously represented the 10th District of Virginia, and she's been very public about her PSP diagnosis, both before retirement and after. And CurePSP, continues to have a strong working relationship with the Congresswoman. And in fact, we had planned to host a congressional briefing on the Hill with her in late October, but had to cancel due to the government shutdown, though we're still hoping that we'll be able to reschedule this at a later date. And a second a second event that was particularly noteworthy, sorry, if you don't mind going back, Julie, thank you, was meeting with Congressman Subramaniam's office. So Congressman Subramaniam succeeded Jennifer Wexton to represent the 10th District of Virginia in January of 2025. So he took Jennifer Wexton's seat, but he has continued to be a big champion for our community. He went as far as to introduce a resolution to designate May as PSP Awareness Month. And when we met with him at the policy forum, he reiterated his support and commitment to continue pushing our policy priorities forward in Congress. So we look forward to continuing to work closely with the congressman and his staff in the coming years and months. You can go ahead, Julie. Thank you. So at the end of October, the CurePSP Board of Directors, seven of them, met with 9 key congressional offices on Capitol Hill. So the board members shared personal stories and highlighted the real-world impact of federal investments into PSP, CBD, and MSA research, including advancing the development of biomarkers and clinical trials. And these meetings were really key to amplifying the message that Congresswoman Wexton has been trying to spread to policymakers, which is we need to do better to step up our fight against neurodegenerative diseases. So we thank the board members for taking their time to have these meetings and really impart on members of Congress just how important these priorities are. Thanks, Julie. Another meeting that we took part in was the NIH NINS Forum, which took place in June of 2025 at the NIH. It was co-hosted by or with the American Brain Coalition, and it also marked the 75th anniversary of NINS. A standout moment was the keynote speech, which was delivered by Congresswoman Wexton. And she shared a very personal look into her battle with PSP, stating that she wanted to, quote, use her story to educate people. And I'm actually going to ask Courtney if she could share the link to the keynote speech if you haven't had the chance to watch it. It's a very impactful speech. It starts at minute 36 of the video cast, if you'd like to take some time to look at that. I think it should resonate with a lot of folks in our audience today. And finally, CurePSP also took part in the American Academy of Neurology Brain Health Summit in September of this year. And that brought together 175 leaders from academia, research, government, industry, and advocacy to tackle the most significant challenges and pursue key opportunities in the field of brain health. So we were very honored to be included in that room and those discussions. And finally, as you can see here on the slide, we have joined 2 aligned coalitions. Number one, the ITEM Coalition, which supports policies for enhancing access to assistive devices and technologies for people with disabilities and chronic conditions. And obviously, this is a cause that I think is near and dear to our heart, as Julie outlined earlier. These assistive technologies and devices are required for a lot of people in our community. And we've also joined the American Brain Coalition. And joining ABC should be a great chance for CurePSP to have our voice heard in Congressional Neuroscience Caucus briefings and sign-on letters and awareness-raising campaigns. And one such example of a sign-on letter that CurePSP recently signed on to was a letter to Congress requesting a long-term solution to the Medicare telehealth flexibilities that have lapsed as a result of no congressional action before October 1st. So I know I covered a lot here, but all of that is to say is that we are making great strides as a committee to have our voice heard on Capitol Hill, and we're trying our best to strengthen key relationships with policymakers to push forward our legislative agenda at the federal level.
Awesome. Thanks, Karen. And so with just a few minutes that we have left, just wanted to see if there's anybody in the audience, even though I can't see you, who would be interested in joining us. So we need kind of all hands on deck. So if people are interested in learning more about the Advocacy Steering Committee, we encourage you to reach out to Jessica. I put her email on the slide. And if you're available, we're meeting next Monday, November 24th at 10 a.m. Eastern Time. And if you just want to come and observe and see what we're about, we would love to have you. We have a bunch of subcommittees, as Karen and I kind of went through previously, and are trying to really do what we can as a really powerful volunteer committee to to really move the advocacy program at CurePSP to the next level. So if any of this sounds interesting to you, we'd love for you to join this meeting. And if you can't join this meeting, still email Jessica. I'm happy to meet with you. I know she would probably be happy to meet with you to learn a little bit more about getting involved at a deeper level. And if that's not in the cards for you, that's totally fine. We will take any and all opportunities for people to engage in legislative advocacy in the way that makes the most sense for you. So in 2026, we'll have a lot of opportunities to do that. One of the pieces that we're looking at is creating sort of a regional action group. So using those regional, or sorry, resource development guides, trying to find people who are in the same area that would like to work on some of those initiatives to get May Month of Awareness um, um, resolutions in your own states together and sort of create a little bit of a network. We're also focusing on ways that we can continue to really hear from the community. So creating a suggestion box around what are the most important issues that you see that there's a legislative fix to, or an advocacy fix to, or just raising awareness about what an issue that you're having. It could be minute, it could be something that's much larger. But we don't want to wait until we, send a survey to everyone. We know that this is timely. And we honestly don't have time to wait. So we want to create more opportunities for people to give feedback and get involved. And so that's one of the big pieces that we're working towards in 2026. And so, yeah, join us. We'd love to have you. We'd love to talk with you about advocacy and see where it would fit for you. So I don't know. With that, I would love to open it up for a few minutes of question and answers, if anybody has any.
Yes. Thank you both for this. This was fantastic and super informative. A question we have is so outside of kind of the subcommittees, which everyone should actually absolutely consider joining, do you have any suggestions on how people can advocate in their daily lives?
Yes. So I think there's a few things. Um,
Mhm.
I think one of the biggest things is to pay attention to what's happening. And what I mean by that is, things are changing really rapidly in Washington. And if something is impacting you, whether that's Medicare coverage, or research funding or something like that, we want to know. So I think part of what you can do is to be an advocate for yourself and tell us what's going on. I also think that there's a lot that we'll be doing in 2026 that people can take. So actions that we can take, which are like letters to send to Congress. We'd also really love to start setting up meetings with your congressional representatives about the issues that we really care about. So I think it's sort of a twofold answer. And Karen, I welcome anything that you think too. But I think part of what I'm finding in like just my own life is paying closer attention to the impacts of federal decisions. And sometimes I think people don't realize that those federal decisions impact them in some way, shape, or form. So I think sort of heightening that awareness a little bit is something that can be really helpful. But Kieran, I also.
Yeah, I think just piggybacking off of that, I think just really realizing the power that you as a constituent have. Just picking up the phone, calling your congressman or congresswoman's office, leaving a message with a staffer, that all gets relayed back to your representative or senator. And as Julie mentioned, writing letters we have in the past, and this coming year, I'm sure we'll be putting together toolkits to make it very easy for you to just um, copy paste if you want to a letter, a standard form letter, or revise it to make it more personal to you, and really just reach out and get your voice out there. I think as much work as we're doing here on the steering committee, so much of the power and so much of the voice lies with you, the constituent.
Great, thank you. The last question we have time for is somebody had mentioned in the chat they're not from the US and they're curious about steps to take general advocacy. And I know that might be difficult to answer. And if the answer is you don't know, that's okay. But I thought I would ask you guys
I,
relay that.
I think it's a great question.
Mhm.
These diseases don't care where we live.
Mhm, absolutely.
So I think that makes a lot of sense. And as a dual Canadian citizen, I understand the impact that it can be, and also knowing the role that advocacy plays in other countries. So my suggestion would be to figure out what's happening in where you live. What are the mechanisms in whatever country you're in about getting involved in, like, is there a listserv of your, your local representative, or whatever the equivalent would be,
Mhm,
and seeing if you can educate them about these diseases. And if you're in Canada, which you might not be, but if you are, we have centers of care there too, that, get funding.
mhm.
So I think there's multiple ways, and I think a lot of it is just, again, sort of looking at your own community and what are the resources for raising awareness with your local representatives, and using that as a way to sort of create a network of people around you, um, to help sort of raise that message to a higher level.
Great. And I do want to add to that that CurePSP is happy to supply anybody with materials. We currently have materials in Spanish, and then we're adding Canadian French and then some other languages. And so if you ever feel the need to have your these resources in a different language, let us know. It's not an automatic guarantee, but we do love that feedback to know what people want and where. So of course you can send those to your local people or anything like that. So appreciate your time, Julie and Kieran. This was super helpful, and it's great to have you today.